Hello, this is Kathy Wadsworth. I am getting ready to demonstrate a head-to-toe assessment for MN 552. Before I begin, I just wanted to make a couple of statements. First of all, I understand that it is the norm that physical assessments are performed or that the patient is always approached on the right side. However, due to the setup of this room, in some cases, I may be approaching the patient towards the left. Also, due to lack of certain equipment, there are some exams that I will not be able to physically perform. However, I will be explaining those in detail. Also, because my patient has an extreme sensitivity to bright lights, there are some examinations that he has requested that we defer. However, I will be explaining those exams in detail. So any examination that I'm not able to perform, I will make sure to explain how the exam would be performed. So we will begin now.
Come in.
Hello.
Hello.
My name is Kathy. I'm going to be performing a head-to-toe physical examination on you today. But before we get started, I just have a couple of questions. Could you just tell me your full name and your date of birth?
Ben Wadsworth, 4/22 of 1980.
Okay, very good. And you prefer to go by Ben?
Yes.
Okay. And Ben, can you tell me where you're at today
Your office
and why are you here?
for an assessment.
Okay. And what is the date?
December 6th.
That's correct. And the current president of the United States.
Donald Trump.
Okay, wonderful. So I like to begin just by inspecting my patient. I take a kind of a look from head to toe. So I'm just inspecting. And one of the things that I look at is just kind of your general state of health. So how you appear. I like to look at your ease of breathing, which everything seems to be normal at this point in time. I look at your height as compared to your weight and your general build, and then also just your development as an adult. Your weight was obtained by the nurse prior to this assessment, and I noticed that you weigh 230 pounds. So this seems to be fairly appropriate to your height. So I also like to take a look at posture and motor activity. I see that you are making some movements. Everything does appear to be symmetrical at the time. I take a look at how you're dressed, appropriateness of dress, your grooming, personal hygiene, and just kind of take note of any odors. I also take a close look at your facial expression, make sure that those are appropriate to the situation, and just make sure that everything on the face, all of your movements of the face appear to be symmetrical as we're talking. So had your nurse not collected the vital signs, I would have gone ahead and done that, but she has already taken care of that for me, and so I'm just going to repeat those back and just let you know that they are quite normal. So your blood pressure was 124/82, your heart rate was 64, respirations were 16, even, non-labored, room air, no oxygen required. Your oral temperature was 98.6. So I'm just going to take a quick listen with my stethoscope over your trachea real quick. Okay, very good. Thank you. Okay, so the next thing that I'm going to do is just kind of an examination of the head. And so what I'm going to do is feel your scalp, kind of part the hair a little bit, take a look at your scalp. I'm feeling for any abnormal lumps or bumps or just lumps and bumps in general, looking at the thickness and disbursement of your hair, looking for any patterns of balding or anything of that nature. And your hair looks well distributed. You have plenty of hair. I don't feel anything abnormal. Also, again, I just take a general look at your face, the skin of your face. The color appears to be normal. There are no blemishes and there's no suspicious nevi to note. Excuse me. Okay, so the next thing I'm going to do is just start an examination of your eyes. So I'm going to give you this card, and I would like for you just to read the letters down at the bottom without your glasses and tell me what those letters are.
CEFTAB.
Very good. Okay, thank you for that. All right, so now I would like for you to just tell me, when do you see or do you
Now.
see? Okay, very good. So I'm just checking your visual fields with a wiggle test there. So the next thing I do is I take a look at your eyebrows, kind of just notice how the hair is dispersed. Are there any balding areas? Are there any scales underneath of the eyebrows? Everything looks fine there. Everything is symmetrical. I also take a look at your eyelids. Could you just shut your lids for me? Okay, so here I'm just looking to make sure that there's not any redness, irritation, or any swelling of your eyelids. And I'm also looking at your eyelashes just to see, are they thinning at all and which direction that they're pointing in. And everything seems to be symmetrical and normal there. So the next thing I'm going to do is have you open your eyes. I want you to just look up a little. You're going to feel a little bit of pressure where I'm just going to pull down on this bottom lid. And I'm just looking at your sclera and your conjunctiva, and everything looks fine there. There's no irritation, no excessive redness. The color is fine at the sclera. Okay, so my patient has asked to defer a couple of these examinations just because he has a severe sensitivity to light. Too much bright light directly in the eye actually causes him to have discomfort and extreme headaches. So this next test we're going to defer, but what we would be doing is using a pen light just to assess the cornea and the lens of the eye. And we would just be looking to make sure that everything is intact and normal there. And then the next thing we would do is dim the lights and then check pupils to make sure that they're equal and reactive to light. But again, we're going to defer this test at this time. So now what we're going to do is we're going to see how well the eye moves. We're going to check ocular movement. Okay, so we're going to start by having you look directly to keep your face straight ahead, but move your eyes completely to the right, and then to the right and down, to the right and up, and then let's go to the extreme left, and to the left down, and to the left up. Okay, very good. So the eyes move symmetrically. I don't notice any nystagmus or any concerning movements of the eyes when you do those movements. So now I'm going to take my ophthalmoscope and I'm going to be looking in the eye. And since this is not an actual ophthalmoscope, you won't have any bright lights shining in your eye. I'm just going to demonstrate that what I would be looking for now, I would be looking at your fundi and looking at your disc to make sure that everything is nice and sharp. So if you can just look over my shoulder. Okay. Over my shoulder. Okay, very good. So the disc is sharp and the fundi is normal. So the next thing that I'm going to do is I'm going to visually inspect your left and right ear, and then I'm going to be just doing some light palpation and checking for any lumps or bumps. So everything looks symmetrical and I don't feel anything concerning at all. Your skin is of normal color, so that is fine here. So now I will be taking my otoscope and holding it upward. I would be looking at your tympanic membranes and looking at the ear canal, and everything is fine there. There's no redness, there's no bulging, and no sign of fluid. So I'll come around to the other side here. And the same over here on this side. Okay, so the next thing I'm going to do is stand behind you, and I'm gonna do something called a whisper test. So in this case, I'm actually gonna be coming around on the left side to come behind you. Normally, I would perform this from the right and then behind. So I'm gonna occlude your ear with my finger, and I'm gonna whisper some letters, and I would like for you to repeat that back.
1, 2, 3.
Okay? And I'm gonna whisper something different this time, and I'd like for you to please repeat that back.
A, B, C.
Okay, very good. So you have passed the whisper test. Had you not passed the whisper test, I would have performed 2 additional exams, one being the Weber test and the other being the Rhine test. And with that, I would have to use a tuning fork, and we would be testing for additional hearing problems such as a conductivity problem. But in this case, that's not necessary because you passed the whisper test fine. Okay, so the next thing we're gonna do is examine the nose. And I start just by taking a look at the nose, making sure that it is symmetrical on the face and centered. It is fine. I just take a look at the nares and make sure that they are not occluded, and that looks fine. Then I'm going to also just inspect a little bit further with my light. And I'm just looking for any redness, any deviation of the septum, and any type of crusting or exudates, and everything there is fine. Okay, and now I'm just going to apply a little bit of pressure on your frontal and maxillary sinuses. Just let me know if you feel any discomfort here or here. Okay? Okay, very good. All right, so now we're going to move on to the throat and mouth portion of this physical examination. So I start by taking a look at your lips, and I'm looking to see for any cracks or fissures, any blemishes on the lips, anything concerning any suspicious nevi, and I do not see anything there, so that is fine. The next thing I'm going to do is just inspect your oral mucosa. So if you could just open your mouth for me, please. I'm going to take a look at your teeth, your tongue, your gums, and the back of your throat. Okay, so I'm looking underneath of your tongue, I'm looking at your teeth, I'm looking at your gums, and can you flatten your tongue for me, please? And say ah.
Ah.
Okay, and looking at the tonsils and the uvula. So if I had a tongue depressor available, I would be pressing down on the tongue and looking closer at the tonsils, the uvula, closer at the back of the throat, and then I could also check your gag reflex. However, excuse me, that equipment is not available to me at this time. Okay, so now I'm going to do the examination of your neck, and we're going to start by just palpating your lymph nodes. So we're going to go in front of the ears, behind the neck. Okay, so I don't feel anything concerning there. There was no tenderness. Okay, and now I need to check to see that your trachea is midline. And then can you just take a drink of water for me, please? Okay, very good. I'm just going to feel here. I'm feeling for your thyroid. Okay. And then you also are to inspect the thyroid from behind the patient. Normally I would approach from the right, however, I'm gonna go from the left and go behind the patient. Okay, very good. Okay, and the next thing I would like for you to do, we're just gonna check the range of motion of your neck. So if you can look down for me, and then look up, okay, and then look from side to side. Okay, and then if you could also try to put your ear down to each shoulder. Okay, very good. Any tenderness? Okay. And then can you shrug your shoulders for me? And again? Okay, very good. All right, so now the next portion of the examination is to look at your back, examine your posterior thorax, and then do a lung assessment. So I'm gonna come around to the left. If you can turn towards, yes, perfect. Thank you very much. Okay, so I'm just gonna palpate your upper spine here in the upper muscles of the back. Do you feel any discomfort there at all? Okay, and now I'm observing the contour symmetry. I'm looking for any deformities in the back. And I'm gonna come down here to the 10th rib and check expansion. Can you breathe in? And breathe out. Okay, perfect. All right, and now I'm gonna place my hands on your back and I'm gonna ask you to say 99.
99.
And again.
99. 99. 99. 99.
Okay, very good, thank you. So now you're gonna feel some light taps on your back. I'm gonna perform percussion, and this is gonna be in a ladder formation. Okay, very good. And so now I'm gonna just have you breathe in for me deeply and let it out. And then again over here, breathe in. Okay, so what I'm checking there is just excursion to make sure that your diaphragms are moving properly up and down. So now I'm just gonna listen to your lungs. Excuse me. Okay, I don't hear any concerning breath sounds. Everything sounds normal. There's no adventitious sounds at all. However, if there are some additional exams that I would do, including bronchophony, egophony, and pectoraloquy, but I'm going to go ahead and do that anyway, just for the sake of demonstration. So I'm going to ask you to say 99.
99.
Again.
99. 99. 99. 99. 99. 99. 99.
Okay, very good. So now the next thing I would like for you to do is say E, E, E.
E, E, E. E, E, E. E, E, A, 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 A.
Okay, very good. And so finally, I'm just gonna have you whisper 1, 2, 3, 1, 2, 3. Okay, very good. So the final part that I want to do here is you're going to feel me just kind of give you some taps back here, and I'm just checking for tenderness in this area. Any tenderness?
No.
Okay, very good. So now if you can just set straight again there. So now I'm just going to do the examination of your upper extremities, and I'm going to start though first of all by testing your TMJ. So can you open and close and open and then move from left to right, open and close. Okay, very good. Any tenderness there?
Mm-hmm.
Okay. So now I just need to take a look at your hands here. I'm looking at the joints of your fingers just to see if there's any swelling or concerns there. Do you have any tenderness?
No.
Okay, any tenderness there? Okay. Tenderness in the elbow? Okay, and now I'm just checking your shoulder. Any tenderness here? Okay, and then can you move your arms back and both, and then forward? Okay, very good. Okay, can you raise your arms out in front of you and then up over your head? Okay, and then bring them back down. And can you bring them out to the side and then palms up and palms down? Okay, very good. And then can you place one hand behind your back and try to touch your shoulder blade like this, and then do the other one. Excellent. Okay. Now hold your arms out like so, your elbows relaxed. Just relax your elbows. There we go. Like this. Okay, perfect. Now, can you turn your palms over and then back up, please? And then back over and point your hands down and then point your fingers up to the ceiling and then come back to the middle. Point your hands in this way. Try to keep your arms and then out. Perfect. Very good. Okay. Can you grasp my fingers for me, please, and squeeze? Thank you. Very good. I'd like to see some thumb range of motion. Okay. Can you grasp your thumbs and then move your hand down and up? Very good. Okay. Now, if I had a reflex hammer at this point in time, I would check your biceps tendon, which would be here by placing a finger and giving a tap. I would come back behind the elbow to check there, and then just a couple of inches from the wrist, we would also check your reflex there to elicit a response. Okay, the next thing that I need to do is just check your sensation. So I realize that you're wearing a long sleeve t-shirt. This would probably be better if you weren't. But for the sake of examination, I would just have you explain to me if what you are feeling is dull or sharp. So this is dull, this is sharp, okay?
Dull, 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 sharp, sharp, dull, sharp.
Okay, very good. Okay, so now I just need to check for muscle tone and bulk, and then also check the strength of your muscles. So I can see that you have muscles here. The tone appears to be fine. So I'm gonna have you bring your arm up like this, and then I want you to not let me pull your arm down. Very good, let's do this side as well. Great. Okay, now hold your arm out like this. I'm gonna try to push your arm upwards. Don't let me do that, okay? And again over here. Perfect, okay. All right, so now I'm just gonna have you put your finger to your nose, and then I'm gonna hold my finger out and I want you to touch my finger. Okay? All right, very good. Let's do the other side. Okay, and now let's just check some rapid movements of your hands. So let's do thumb to each finger. Okay, very good. Now put your hands on your thighs and then turn them over back and forth quickly. Okay, very good. All right, so now you can just go ahead and lay on the examination table and watch out for our office friend. Okay. All right, so now what I'm gonna do is just be, I'm gonna palpate your chest. If you could put your arm, yes, very nice, thank you. I'm gonna palpate your chest here for any tenderness. Everything feels fine there. And can you say for me 99?
99, 99, 99, 99.
Okay, very good. So now I'm just looking for your pulse. Okay. Okay, very good. So now I'm just gonna do some percussion here. Okay. So then while you're in this position, we're gonna go ahead and do your cardiovascular examination. So the first step is to measure your JVP. So Okay, and that is 3 centimeters. So that is normal. And I'm just going to have you look this way for me. I'm just going to feel your carotid. And then look this way for me. Okay. And I'm just going to take a listen. Okay. And then this way. Okay. And now I'm just going to check for any heaves, thrills, or bruise using the palm of my hand. I already located your apical impulse. So now I'm going to listen to your heart in the 6 positions. Okay. All right, so we're going to move on to the abdominal assessment. So now what I'm doing is just inspecting the contour of the abdomen, just looking to see, is it flat, is it rounded, is it protuberant? The next thing that I will be doing is auscultating your abdomen. I'm just listening for any vowel sounds. Okay. I'm also going to listen for the aorta and the renal and iliac vein arteries. Okay. Okay, so I heard normal vowel sounds, and then I also attempted to auscultate the aorta and the iliac and renal arteries. So now I'm going to do some light palpation, and then we'll proceed with deep palpation. And you just let me know if you feel anything that's uncomfortable. So just starting light. Anything uncomfortable?
No.
Okay, so now we're just going to be deeper. Okay. And then if I push and release, do you feel any pain?
No.
Okay, very good. Okay, so the next thing I'm going to do is percuss your liver, and then I'm going to attempt to palpate your liver. So we start below the umbilicus and at the midclavicular line, and we just palpate. until we hear a change in the sound. Okay, and then we could measure that. And so now, I'm just gonna have you take a deep breath in and out. In and out. Okay, let's do one more time. Okay, very good. All right, so now I'm just gonna reach over and we're gonna percuss the spleen. Okay. And then can you breathe in and out? Okay. All right. So the next step then would be to palpate the kidneys, and of course you have two kidneys, one on the left and one on the right. To assess the left kidney, ordinarily the examiner would come around to the left side of the exam table. However, because of the setup for this room, really I would not be able to do that. Today I'm just going to, for purposes of the examination, palpate and capture the right kidney. Take a deep breath and let it out. One more time. And let it out. Okay, very good. And then finally, I'm going to palpate the aorta. Okay. All right. So now we're going to move on to the lower extremities, and we're just going to start by assessing the bulk of the muscle. So just kind of looking at your quadricep muscles and your calf muscles. Everything appears to be symmetrical there. Tone seems to be normal. The next thing I'm going to do is just palpate your knees. If there were any concerns with the knees, there are some additional exams that we can do where we assess for fluid. And we can also check for concerns with the ACL and the MCL as well. The next thing I'm going to do is have you move your leg outward. If you can move this leg outward. Very good. And then can you cross it over? Perfect. And then let's do the other leg as well. Okay, very good. And just relax. Can you bring your knee up to your abdomen? Okay, and then let's do this one. Okay, very good. And then are you able to point your toes down and then point your toes back up? Okay, excellent. So the next thing I'm going to do is just check sensation. So I just want you to know that this is dull and this is sharp. Okay? So when you feel something, just please let me know if it's dull or sharp.
Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay, very good. Okay, so now I'm just gonna palpate your ankles here. I'm just kind of feeling for any abnormalities, any tenderness when I palpate at all? No tenderness. Okay. And then I'm just also checking for tenderness in the toes and the feet, assessing the joints there. Any problems there?
No.
Okay. And I would like for you to come up to a seated position. And can you, at this time, swing each leg out and then back? Okay, any problems there? All right. So at this time, I can elicit some deep tendon reflex response. So we'll start here. And there. If I had a reflex hammer, then I would also assess here at the Achilles as well. Okay. So the next thing I would like for you to do is stand up for me. Okay. And then can you swivel at the waist? Very good. And can you bend forward and then backward a little? Okay, great. And then can you do any squatting? Okay, perfect. One more time. And great. Okay. So now I would like for you just to walk from heel to toe, just a few steps and then come back to me. Okay. And then can you walk on your toes? Okay. And then I'm going to have you walk forward on your heels. Okay. And then let's just stand here by the exam table. And I'd like for you just to close your eyes for me, please. So here I'm just looking for any sway or any drift one side to the other. And then can you hold your arms straight out in front of you with your palms up? Okay. And then don't let me push down. Perfect. Okay, very good. You can have a seat. And then one final exam that we would do, ordinarily you would use the handle end of a reflex hammer to elicit this response. This is the Babinski. In many cases, this is reported as somewhat uncomfortable. Okay, and that was a normal response. All right, that concludes your head to toe physical examination for today. Thank you very much for cooperating, and I hope you enjoy the rest of your day.
You too.
Thank you.